just to be most effective in supporting one another and coming up with solutions and ways to move forward. We'll be going over the first survey, the phase 1 survey results. And then we'll be hearing from Jean and Jeanine on SELN principles, and that's the State Employment Leadership Network. We're really grateful to be a part of that network. It's been very valuable. There's a lot of talent and knowledge and expertise and just passion and caring in that group. So it's super awesome. And I'm really excited for everyone in our state that gets to be engaged in this and gets to learn and participate with Jean and Jeanine. Just a few housekeeping items, should be pretty simple. We are recording the SELN presentation portion of the meeting to share. When we have the open discussion, we're going to be turning the recording off because we want people to be able to be engaged and be authentic and have a sincere, open conversation. And that's how we'll be doing this with every community of practice meeting. So within Zoom, you can use the chat feature to ask questions or participate. You can also unmute yourself, or you can raise your hand. So please use any of those avenues. If you're not talking or asking a question, please keep yourself muted to prevent the feedback that comes through. And that is, for those of you who are maybe not as familiar with Zoom as others, it's just along the bottom of your screen. It should probably be on your far left, should be your microphone. So I want to talk a little bit about what is the purpose of the community of practice? Thanks, Amy. Over the last several years, we've been working to help our system shift to enhance the opportunities of people we serve. We've really been looking in two main areas. One, Utah is an employment first state, and we have been since 2011 when it was designated by our state legislature. DSPD is committed to employment first, and every person in DSPD services and on our waiting list, we believe has the option of working in competitive jobs in integrated settings. For some people, this may take time. It may take years to find that right job. And for some people, we know that it's a lot faster than that. And then, of course, there's everything in the middle. If they want to work, we are committed to help them reach that goal through our efforts. But we know that also this means by supporting our providers and our support coordinators that are working with people daily. We also understand that not everyone wants to work right now. We often get questions around that. And the reasons could be for anything, right? They may be going through medical treatments. They may be retired. They just may be in a place where they're not ready to be working. That doesn't mean that, right, we don't believe a person can work, or if someone's going through medical treatment, it just means it's something that would be revisited later. It's not a permanent state that would befall a person. And we also recognize that people change their minds. And so part of this is really continuing these person-centered practices and opportunities for people. Employment first means that competitive integrated employment, so you see often the CIE, right, that acronym, but competitive integrated employment is the first and preferred option for people. But it's not the only option. If a person doesn't want to work, they don't have to. And service options for other activities are available for people. Secondly, Utah has been working with providers to increase opportunities for people we serve to access, be included, and integrated into their communities beyond work. Community inclusion is the opportunity for people with disabilities to live in and have full access to their community to the same extent as their neighbors, and peers. Well, being valued and treated with dignity and respect. Belonging to a community is built on a true connection with other people. Community integration means actively working to not only bring individuals into the community, but also ensuring that they're able to contribute to the development of the community and feel they're an integral part of it. None of these are easy tasks. And I say that like, I'm saying that and I'm just kind of second guessing this note. Like for some people, actually they're gregarious, connecting is easy. And for other people, it isn't. And supporting someone, it definitely takes a different skill altogether. And it requires a mindset shift, programmatic shifts, policy, right? And seeing people in a more holistic way. We recognize that providers and support coordinators, families, people we serve, and state employees have worked towards change in the areas of employment and community inclusion over the past several years. We also recognize that people have run into some significant challenges or barriers, and that's why we're putting together this community of practice. That's why we're here today. The purpose of the community of practice is to have a space to collaborate with peers. Each provider and support coordinator agency runs their programs and services a little bit differently, which is good. It helps people get that right fit and the right support. It provides a lot of options for people we serve. And it helps us see that there's more than one method of achieving the same goal. And we're grateful for the creativity that we've seen and innovation, and hope that you'll be able to collaborate and find additional ways to innovate and find solutions and overcome barriers. We have Jean and Jeanine from the State Employment Leadership Network here today as well, and they'll be sharing some national best practices. They'll answer questions and they'll lead discussions. They have great experience just historically and currently. They're amazing women, and we're so grateful to have them on the call. They've worked with many states. They've worked with national experts. They are national experts themselves, and they'll be sharing that with us. So as you take all the information you receive from these meetings back to your organization, you'll be asked to implement the ideas you come up with to overcome the barriers and the challenges that you're facing. And we'll be doing the same. The only way to shift our system meaningfully is for all of us to be working on it together. And in order for us to do that, we put together some ground rules for this meeting, and we'll just go over those next. So some simple guidelines, I think, are things that are not going to be surprising to anyone on the call. You guys should all have a copy of the ground rules and the community of practice document. So I'm not going to read it to you, but I just wanted to highlight some key points. The guidelines for the community of practice are pretty straightforward. It's a space where everyone can share their perspectives, their ideas, methods they've tried, their experiences, and anything else that's helpful to finding solutions and supporting and sharing information with one another as we look to overcome barriers to employment or community inclusion. We ask everyone to be respectful in what you share and how you respond to others. Debate is encouraged, so having a different opinion is absolutely fine. And it's welcomed as part of this learning process. And we're just asking that it's done in a manner that's respectful of everyone who's participating. And we're also asking that you thoughtfully consider everyone's ideas. We're all definitely coming with ideas. And we want to just make sure we're open to everyone's ideas as well. Each meeting is going to have a designated topic or a theme, which will be one of the 4 top priority barriers that have been identified through the surveys that have gone out. And that process is going to be reviewed in a minute. And we ask that everyone stay focused on the topic of the meeting. knowing that we'll be getting to the others. Our time is limited in these meetings, so please bring other questions or discussions to the facilitators or the state staff outside of the meeting time. We've heard in particular your questions and concerns about legislative funding and service rates. We understand that this is an element of transformation. However, that is not one of the topics that we're going to be addressing as part of the community of practice. We'll continue to discuss these concerns in meetings and separate discussions. And we've submitted our joint plan with health on how we would like to support our system with the ARPA funds to CMS and are awaiting a response for them. And it does consider, right, how to best support our system. In the agreement, the section that we ask you to, okay. In the agreement, we're asking that you commit to attending and following through with the assignments at each of these meetings. It's going to be critical and essential to have these be successful and meaningful and effective. We're asking that you also don't have a replacement come to a meeting for you, because it's building this community collaborative effort, and having people shifting in and out undermines that and makes it less effective. So if you cannot attend a meeting, you can view the recording of the SELN presentation. As I mentioned earlier, you won't be able to hear the discussion, but you'll at least be able to see the presentation. And you'll be able to review the summary notes and discuss this with your peers outside of the meeting so that you can come prepared to the next meeting. Again, our time is limited in these meetings, and it's important to keep the process moving with a consistent group discussing topics and solutions. This also means that everyone participating should actively engage in the discussions and in the development of solutions. And it's important that you share this information and implementation ideas within your organization. This is an action-oriented group that will be given assignments and be reporting back on those assignments at each meeting. You're also welcome and encouraged to discuss and share with providers or support coordinators that are not part of this group. In order for this group to be successful and allow for everyone to actively participate, it's pretty small. And we do want others to benefit from the work that's happening. So we'll also be working on making sure that the recordings from the State Employment Leadership Network, that those are available to others. And we'll be seeking ways to make sure others can stay informed and benefit in a less direct way. So let's take a minute to have everyone on the call introduce themselves. I'll just call out people a couple at a time. So Amy and Bryn, if you guys could each introduce yourselves.
Hello, I'm Amy Huppy, and I am a program administrator with DSPD, and I oversee settings rule implementation, employment supports, as well as privacy and compliance. And I am here to take notes and to listen.
Hi, everyone. I'm Bryn Peterson. I'm a program administrator with DSPD as well, over employment and community integration. Glad to be here.
Thanks, Amy and Bryn. So next I have Addison and Eliza.
I'll go first. I'm Eliza Dethridge with Turn Community Services, and I'm happy to be here too. Thank you.
Okay, we may need to come back to Addison. Know that technology can be tricky sometimes. Next, I have Bob Downing and Carrie Bambro.
There we go. I'm Bob Downing. I work with DSPD and I work with the employment team quite a bit. And so I'm really here just to learn.
And hi, I'm Carrie Bambro. I'm from the Office of Quality and Design, and I oversee the quality management team that does the reviews for everyone.
Thank you. Next, I have Jonathan Burton and Neil Allred.
Hi, everybody. Sorry I was late. I'm obviously in my truck and I had trouble logging in where I was. So I own a company called Innovative Harbor. And so we really service 4 areas throughout the state, primarily St. George, Price, Utah County, and then where I live in Heber City, so Wasatch County.
Neil, you're up. Okay, we might need to come back to Neil as well. And I have Scott Miles and Selena Harris.
I'm Scott Miles. I'm one of the owners from Intermountain Sport Coordination Services. We serve statewide, but the bulk of us are down in southern Utah and out on the eastern reservation area.
Hi, I'm Selena Harris. I am the Employment Services Director for Turn Community Services. And I was trying to cleverly place my son so it looked like I was wearing a crown today, but you know, and I'm a little disappointed I can't see Bryn's snacks on his fridge, but I'll live with it.
Thanks. Then I have Susan Blaumeyers and Tamara Blackwater.
Hi, I'm Susan Blaumeyers. I am a support coordinator and the president of ISCA. So.
And I'm Tamara Blackwater. I'm the program specialist for the employment and community inclusion, working along with Bryn Peterson.
Thank you. And now, I don't know if Addison or Neil, if either of you are able to unmute at this point.
I'm here. My name is Sarah. That's my daughter's name, Addison. Sorry about that.
No problem. Thank you. And
yes, this is Neil Allred with Northeastern Services. Sorry about that.
no problem. I get technology has its quirks. So now I'll leave it to Jean and Jeanine to introduce themselves and lead off. So we're super excited to have you guys.
Hi, I'm Jeanine Zlockie with the State Employment Leadership Network. Just a little bit, I work for NASDAS, the National Association of State Directors for DD Services, in partnership with Jean, who will say hi, from the Institute for Community Inclusion, to support Utah and the State Employment Leadership Network. It's been such great work. Hopefully we met some of you when we came on ground. I don't even know if it was 2 years ago or feels like yesterday, but we really enjoyed visiting your state and we really enjoyed connecting. And I think I just want to say that this is my favorite part of any work we do, being able to connect openly and honestly with folks who are doing the work and supporting people to have good lives. So thank you all for taking time out of your busy schedules to spend with us.
And I'm Jean Winsor. I'm a senior research associate with the Institute for Community Inclusion at the University of Massachusetts, Boston, and also a project staff member to the State Employment Leadership Network like Jeanine. One of the things that makes the State Employment Leadership Network unique and the work that we do is that combination of bringing together national level policy expertise from the National Association, which Jeanine represents, and the research work that we do at the Institute for Community Inclusion. And we think about the barriers to employment and the opportunities to employment really in a very holistic way, both at the ICI and within the SELN. So while the things that we're going to be talking about later today are really focused on providers, all of our work is interconnected, and we think about what is the impact of this and how do state agencies need to change. What is the impact of things on individuals? What is the impact of things on families? And we hope that as you get to know us and work with us, that we are able to really help to thread the needle of these really diverse and interesting perspectives and roles that everyone on this call has. But also to know that everything that we're bringing to you is based in more than 30 years of research that's happened at the ICI and our national partners and collaborators with other universities that are focused on employment for people with intellectual and developmental disabilities.
Okay, Bryn, I think we're going to turn the time to you to talk about the survey method and results.
Excellent. Thank you. First of all, I just want to say I'm super happy to be here and to listen and learn with you. I'm excited for what this community practice is even today in the next few months and what it could be in the future. I'm excited for those possibilities. I think we're just to do a kind of a quick introduction. All these efforts are centered around a project we started in the past, in the few months ago, called the Community Inclusion Project. And that's a 2-phase project. So this community practice kickoff here today is phase 2, but phase 1 was a series of surveys, and we're still working on some of those. The first survey was sent out about March of this year, just asking some open-ended questions to you about the barriers you faced in helping folks gain competitive integrated employment and be included and integrated more in their communities. And then the solutions that are currently in use around Utah. These are really Utah-based questions that we're working through. Survey 2 took all of those answers, and there was quite a few of them, and put them into categories and asked you to prioritize them. I'll share just some quick highlights of the survey 2 results, knowing that we are not done with the survey, and in July we're going to send out another round to further prioritize those things. That way, as we're working through some of these strategies that Jean and Jeanine will share, they will address those barriers that you've listed at working as providers and support coordinators throughout the state. You should also know we asked those same questions to parents, but I'm just going to share the provider responses today. So if you want to go to the next slide. So our approach in the survey was pretty simple. We asked 2 basic questions. So what are those barriers to competitive integrated employment and community inclusion? And what are the strategies currently out there and being used to address those barriers? Each of those answers had multiple responses, 8 to 15, some had 4 to 5, 6 or 7, or it was a variation. And so sometimes we repeated those answers with different, we repeated the questions, with different answers to prioritize. So you might see similar numbers as I share the data in the next slide here. Just know that we'll go to the next slide, but round 2 had 43 responses, and then round 3 will be completed in July, which will further prioritize what you're seeing here. So the first question we asked and that I'll share today is asked to prioritize the impact of each of the following barriers in helping a person gain or find and keep competitive integrated employment. So the answers were rated in terms of the most significant barrier to the least significant barrier. So this is the percentage of times that particular barrier was stated as a most significant barrier. So the top 3 would have been that there's a lack of options available for career advancement in the area. staff turnover at the provider agency and transportation. And again, this is specific to employment. We'll go to the next slide. This is the same question, prioritizing those barriers, but we replaced that with being included in their community or community integration. Again, the barriers that you listed were staff and resources. Person has some behavior that's preventing them from fully accessing their community, or that community support to include folks in the local communities and be more integrated. Transportation was there as well, so you can see some similarities. Just know that as we move forward, we're going to kind of look at how all of those answers were submitted and look at kind of the averages as we move through the next round of surveys and prioritize those barriers based on the averages. That's all I have. I can turn the time over to Jeanine to take us further. Thank you.
Okay, thanks so much, Bryn, for all of that data. So again, thank you so much for being here. Jean and I are going to step through, I mean, Jean mentioned on her introduction some of the terrific, but more importantly, impactful research that ICI has done in the area of employment. And some of these activities focused around, I would say, having a Delphi panel of experts, doing some case studies with providers on the ground to really support them to evolve how they deliver services. So Jean and I are going to touch base on, I would say, the top 10 critical or important pieces that they have found through their research that had a real impact on this movement and some of these changes. This input, when I say Delphi panel, came from not only experts in the field, but Jean from staff at the provider agency, management, individuals, their families, so self-advocates. So it was a wide array of expertise on this panel. So let's start by going through what we're seeing as element number one. How about that? So one of the top things that, and what I also want to say about all of these elements, that it doesn't matter where you sit, where I sit, where you sit, if you're from a provider, if you're from the state, wherever if you're a support coordination agency, all of these elements are critical and could be applied to wherever you sit and be applied to your organization. So I really want to make that clear that, you know, having clear and consistent goals from leadership in any agency is super important. Why? You define what your agency wants, whether it's to do better at something, whether it's to develop new goals, whether it's attaching some timeframes to that and assessing your progress. So when we think of these goals, and they could be small or big, audacious, hairy goals, but the important part of it is that we need to have goals in moving employment forward. They should really be measurable. They should be flexible, okay? It's not a one size fits all or everybody at one time. As Jean always says, it's a one person at a time. You know, they should be compelling and really easy to understand by everybody. And then lastly, I think that when you do talk about your mission from wherever you sit, they should really reflect the mission. So that was one of the things that, you know, and this fits in line with other research that has been done and we'll say the area of leadership. So I think this is really, really important, setting some clear and consistent goals within your agencies. Next. the second piece that really, really fits well with your agency goals, right, is our agency cultures. And I'm sure all of you could have some input and feedback on what you feel that your agency culture is. Are we always 100% supporting inclusion? We try, that's our goal. But it's something to really take a step back and examine. I think we get, you know, heels in and we're all plugging away and doing all this important work daily. But it's really important to take a step back and think about our agency's culture. Do the values that we have support people in the community? Is that the culture, that values, you know, hey, everybody jump in on this. What are your ideas? Are there positive thinking? You know, let's open up creativity, innovation, you know, creating that safe place for everyone to feel that they can do that, right? And sometimes it's setting time aside to do that, because I know, believe me, I started as a support coordinator way back in the day, which is my most valuable role to date. But that taught me a lot about, do I have the time to really have those kinds of conversations with leadership, and what is our continuous quality improvement route? What does that look like? So these are all things that we need to talk about and think about. Staff mentoring, having trainings that are value-based, you know, giving the support to everyone that they need, which I know is really hard when you're dealing with a DSP crisis, but really, you know, thinking about that and seeing it through. And then lastly, I would say aligning, you know, everything that's occurring in the environment that we're working on to this thinking and this support for inclusion. The next, and you know, I want to say, feel free to jump in here. If anything I am saying is resonating with you, or your agency or your has started to do any of this, please stop me. We want to hear from you. We're grazing over these 10, you know, areas that we found to be very impactful, but please just jump in. Element 3 is, you know, active person-centered job placement. And I think I'd take that farther, you know, when we're thinking about just our different roles on this call. Active person-centered planning, making sure people are at the center. And by that, we mean, you know, always having that goal, as Angie pointed out, which is the main reason for this community of practice, is having the value of supporting people in their communities as our top priority. Creating a culture that values, as I said, and this is tied to the other one, that environment to just jump in with your ideas. You know, having that enthusiasm, never feeling pressure, being able to find jobs for folks one person at a time. So that could be part of that goal setting, you know, and maybe inch that up every month. Element 4 is really strong internal and external communication. And, you know, I can say this, you know, myself, just communicate. Be overly communicative, right? People may get tired of it, but I'm going to tell you, depending on where they are and where they sit and being part of this, we have to communicate clearly. And part of communicating clearly is really being authentic, good listeners, you know, having expectations for a wide range of people we support, not just a certain cohort of people we support. This helps to provide assurances and avoid confusion, and, you know, and everybody, you know, singing from the same hymnal, you know, having you know, this allows us to tackle resistance head on, right? Because we're all very educated now and we're part of this change and we're communicating about it. And this really goes into having simple and visible practices and making decisions about employment that I said are clear and authentic. You know, it really boils down to being transparent. I don't think any one of us wants to guess, right? And we really want to make sure that we're all, you know, marching and trying to do whatever we can as an organization to support employment and support people to have good lives in the community. And also part of communication is, you know, we don't have to have an answer for everything. I mean, nobody does, right? I mean, let's be honest. If we don't know the answer to that, let's talk about it and try to, you know, push through it. So, and I think that's what we want to do today. This one for us, Jean and I, is really, really important. I mean, Angie said it in the beginning, everybody has said it. We want this to be a space where you can just let your hair down, talk about what you're struggling with, talk about your things that you have pride in, talk about things that you're trying that is new and exciting. But we want to start this day off with that type of partnership and communication. Element 5, the thing that always comes up, right? Show me the money. What's, you know, what are the financial impacts to all of this? Yes, that conversation should be part of this, but we don't want that always to sort of not like derail our creativity, to say it a little bit differently. It always needs to be part of it. We get it. We understand. Your viability is super important. We need you. We also want to make sure we have direct support professionals, you know, that are highly regarded, that are paid well, and want to invest in this work in supporting people. So, you know, that's taking a good look at ourselves. You know, how are we spending our money? How are our staff spending their time? What are the outcomes that we're seeing from that? Does everything that we develop, and does our, you know, where we're putting our money and what we're talking about in human resources, does that all align with that mission and vision that I talked about in the beginning? Because that's really important too. Are we making changes in job descriptions and expectations because of this? Are we building in the continuous staff development that's super necessary for you to get those outcomes that we talked about? So any and all of those investments have to reflect, you know, priorities of the state's direction and priorities of your direction in your organization, because that's how we're going to really influence outcomes for folks. Element 6, and then I'm going to hand it over to Jean. Element 6 is definitely tied to that reallocating and restructuring. It's really building and thinking about the ongoing professional development of staff that's necessary, right? As I said, we're all busy. We're all doing all of the things we have to do for compliance. We're all trying to make a difference. We are all thinking about new and innovative ways. As Jean put in the chat, we've all been in your shoes, okay? Very long time. So we're coming from a place of not talking at you. We're coming from a place that we've been there and we understand and we get it. We may not know it all or understand everything that you're going through, because each state is different, but we are here to help you look at your workforce, to invest in employees, you know, and you have to do that in a way that really helps them contribute to their ideas, but also is in alignment with your mission. And Jean, am I to do 7 yet, I think, before I hand it over, or were you taking 7? So
it's up to you. If you want to go for it, go for it. If not, I can do it.
I would love to hear from you, Jean Winsor. So let's continue on.
Okay, thank you. Okay, next slide, please. So element 7, customer focus and engagement. And when we think of customers, I mean, we have a really diverse customer base. We have the individuals that we serve. We have their families that are, you know, separate but very connected to the individuals that we care about and support. We have our businesses that we engage with. You know, both, I'm going to talk a little bit in a minute, not just about employment, but about community life engagement. And there are the businesses that we take folks out to and that we are customers of. And then there are also businesses that we support their employees with disabilities. And, you know, one of the pieces that ties all of these elements together is, you know, I like to think of it as much about customer focus and engagement is about building relationships, because I know personally this past year with COVID, I could not have gotten through it without having strong relationships with people that I'm connected to, whether it's the folks in my grocery store who I couldn't see their smiles, but I could see their eyes and I knew that they were trying to share some joy with me that day, whether it was my neighbors who I was waving to as we walked our dogs past one another, whether it was my son's teachers who I was seeing over his shoulder on his Zoom school. All of those relationships are how we, again, help to address these barriers. So, you know, I think it's, you know, customer focus and engagement, but it's really about how we use our relationships to focus on those elements. Next slide, please. Performance measurement, quality assurance, and program oversight. If you know me, which some of you do, you know that I love data. And if you don't know me yet, by the time we're done with the COP, you're going to learn about how much I love data. What gets measured gets done. I think we've all heard that, you know, as a cliche over and over again. And sometimes we have to take a step back and say, are we counting the right things? Whether that's at a state level, whether that's at a provider level, whether that's at an individual level. And really think about, you know, not only are we counting the right things, but are the things that we counting giving us the information that we need to make decisions to move forwards. I hope that as we go through the next several communities of practice with you, you'll start to see how many of these elements are interconnected. And I can't remember the exact element number, but Jeanine talked about resources and resource allocation. And one of the reasons that agencies, organizations, you know, state government struggles when we talk about reallocation of things is because maybe we don't always have the right data to make the decision that we need to, or to be able to inform a decision and really make a choice about our next step moving forwards in that larger plan that Jeanine also has alluded to. And so data is a piece that will consistently come back to and will thread through as we talk about and help you to address the barriers that you're identifying within that Delphi process. Next slide, please. Multiple and diverse community partnerships. And, you know, again, you're going to continue to see the overlap. That intent of focus on relationships with organizations and state systems to create a buy-in for reducing these barriers to employment. You know, we talk about the importance of collaborating with others, school districts, vocational rehabilitation, faith-based organizations, local paratransit organizations. I've seen other states talk about how they work with chambers of, and local communities talk about how they work with their local chambers of commerce, how they are working with their upstate apprenticeship programs, how they're thinking about building relationships and alliances within different parts of the business community. And all of those are really thinking about not just how we relate to those that we already have connections with, but how do we think about who else we need to bring in to help us to reduce these barriers. And so that's another piece that we're going to help you brainstorm through and talk through, and hopefully bring some examples of how we've seen other states or other organizations, the partners that they've brought into those pieces. Next slide, please. So element 10, a holistic approach. And, again, we consider that no one of us is just, one part of our day. If you saw me 1 hour of my day, that would be all you would see of me and all you would know of me. But there's 23 other hours that my life is going on. Not always doing things. Hopefully I'm sleeping some, but there's lots of stuff that's happening when I'm not at my desk and not at my computer. And so how do we consider every single person who we are charged with supporting their whole person? How do we help to think about breaking down silos within individual agencies? Oftentimes we see challenges in other states related to employment and day services and residential services. Well, how do we talk about breaking some of those silos down? How do we talk about creating a shared responsibility for employment across all of the people that touch someone's life? And how do we help people to think about how to reach out to those folks to let them know that employment is their goal and that they'd like them to help support that goal? So that's just a little bit of a taste of what we're going to be going through in the next forthcoming communities of practice, based on what Jeanine referred to as our the Institute for Community Inclusion's work related to understanding how organizations can help reduce the barriers to employment for people with disabilities related to employment. And I'm just going to spend a couple minutes and talk about the other piece that Angie also mentioned as goals and priorities of DSPD, because it's not just employment, it's community inclusion and community integration. And I hope you see the next couple of slides, the same connection that Jeanine and I do between not only helping people to work in their community, but to be a part of their community, and that so many of these concepts are really universal in how we stop creating a employment bucket or an employment line of work and a community inclusion line of work. So next slide, please. So I will be honest with you. So I did this slide. My boss, John Butterworth, whose name you might be familiar with, he always has the best slides. Somehow he is a master of PowerPoint. But when I do things look a little funny on the screen. But really, this whole slide is really just to reinforce that concept of there's a relationship between employment and community engagement. And when we're employed, we expand our community connections. And when we're engaged in our community, we expand our opportunities for employment. And so really these pieces go hand in hand, and there's no right or wrong place to start. So next slide, please. So these next guideposts for community life engagement. And Amy, I'm not sure if the fourth one is on the next slide or if I just can't see it. But my colleague Jennifer Sullivan-Zlockie and a team of other researchers at ICI for nearly 20 years now has been working to support and help better understand what does it mean for somebody to not just be included in their community, but to truly be engaged, and how can we fully support people and wrap around them so that they are really their own autonomous person in the community. They're not the person with a disability who has supports with them, but they are their own person. They have their own relationships. I'm going to pause here. I apologize. Where I live, it's currently very dry. So the work that Jen and other ICI colleagues have been doing has resulted in what's called the Community Life Engagement Guideposts. And I believe that this and the elements of high-performing providers are both items that we're going to ask you to spend some time with between now and One of the things that, again, the connection is individualizing supports for each person. So whether we say it as person-centered supports, whether we say it as individualized supports, it doesn't necessarily, I don't want to get folks to get caught up in like the terminology. I really want it to be about how do we think about one person at a time and what they need so that they can be a part of their community or to be employed in their community. What are we doing to help the person be a member of their community and to contribute back to their community? That's a big piece. Gentleman who I've worked with, Max Barrows, who's from an organization called Green Mountain Self Advocates, which is based in Vermont. He's a nationally known self advocate. He speaks all over the country. One of the things that he routinely says is that people with intellectual and developmental disabilities, they want to contribute. They want to be seen as givers within their community. And as we're thinking about these items, how can we support people to really not just be seen as folks that are there in the community, but are really giving back and are really adding to the vibrancy of our communities? Number three is, again, thinking about how to use human and social capital to decrease dependence on paid support. So another way we often say that in the employment vernacular is, how do we better use natural supports? But I think sometimes that item is scary. We're not sure, can we rely on people who maybe don't have an accountability to a state system because they're not getting paid to do something, to really look out for the best interests of the folks who we care about? How do we help individuals to themselves be more independent? And I think one of the things we've seen this past year with COVID-19 and the public health emergency is that providers and individuals and families have all gotten more experience. I don't want to say more comfortable, but more experience with using different methods and modes to allow people to be more independent, to increase their social capital, and to decrease their dependence on paid supports, because oftentimes those paid supports, it was just really challenging from a public health perspective to continue for a period of time.
So I know you said it was okay to interrupt and say something occasionally. I hope you meant that, because that is what I do regularly.
Yes.
But one of the things I was thinking about, and of course we've always, I always want to increase human interaction and supports, but I try to make, of course I want this person to be independent as possible, because, I think about that, and I think about, like somebody's working and they need a ride, maybe they could get somebody that they work with to give them a ride if it's somebody that somewhere else.
Mm-hmm.
And then I think about the reality of that, and how, quite honestly, if somebody asks me for a ride, after about a month, even if I'm driving right by their house, I start getting irritated by it. I don't want to stop anymore.
Right.
And so I there's that other human aspect of that as well.
Mm-hmm.
Or with families, if we're going to start leaning more on families, we're going to be burning them out. And does that mean that they have to lose their employment? Those kinds of things. So there's a lot of factors at play.
And I think that is really such a valid point, because, I will say I have not commuted in a really long time, but my husband used to have a 2-hour commute to work, and he used his commute time to like de-stress from his day of work. If he had to carpool with somebody, he wouldn't have had that time. And I think, when you talk about how do we figure out what's the right way to do some of this stuff, it's really individualized, and it's really about thinking about not just finding the one solution, but how do we talk about what are the variety of solutions, and trying them out, which, you know, again, I think is the next kind of part of this that can be really anxiety provoking. I'll be honest with you, it's anxiety provoking for me. And so how do we talk about it, and we talk through it? And, you know, I hope that when we, in the next couple of minutes, we're going to move to the discussion part more fully, that we're able to kind of start at least pulling these threads a little bit and thinking about and talking about these things. And then I think the other part, and again, this is Selena, I think, you know, another piece of what you're saying and where you're coming from is, you know, how do we ensure that the supports are outcome oriented and are regularly monitored? Like, how do we know they're working? How do we know this is the right solution? And whose responsibility is it to do that? And how do we go about that in a way that's respectful of all of the folks, that not just, you know, the individual who we're supporting, but all of the folks who were asking to be a part, or who the individual is asking to be a part of their community engagement. Next slide. And this is where I always come back to. And I think the reason I keep coming back to it is because all of this can seem so overwhelming. And that's, I think, the piece. I know whenever I am trying to figure out how to do something differently, it can be really easy for me to become kind of overwhelmed or over anxious, because change is probably the hardest thing any person is asked to do. You know, think about like trying to institute one good habit at New Year's, and how long that takes you to make that a repetitive habit and a repetitive part of your life. It's hard. It's really hard. And so, you know, it's about starting with one person at a time, whether it's ourselves individually, whether it's a staff member, a colleague, whether it's an individual who we support, but just taking this one person at a time and one thing at a time that we want to talk about. So next slide. And then, as Jeanine mentioned too, at the very start of this conversation, the big, hairy, audacious goal, which is a piece that is really prevalent in leadership and business literature, but it's reflective in sort of these other catchphrases that we know. You know, a famous, you know, sporting goods slogan of "just do it." You know, I think that's been around my whole like teen and adult life, and you know, the concept of really just saying we're going to tackle one thing and we're going to move forwards with it, and that's where we're going to start. Another is, you know, Southwest Airlines, which, when I think about a business that has really changed and evolved and grown over time, I definitely think about Southwest. And, you know, there are senior executives talking about, well, we have a strategic plan. It's called Things That We're Doing. And it's not just about saying, we've got something beautiful on a piece of paper. I have lots of beautiful paper. But really, how do we take the words on a page, these PowerPoint slides, and how do we, over the next, again, several calls, help you to begin to make some of these as, you know, inroads or pieces that are different in your organizations and your lives. So next slide, please. And I'm going to pause here and just let folks know that we're going to stop the recording now. So if you have joined, when you joined, it said that it was recording. I'm now going to stop the recording. You should no longer see a small red dot in the upper right-hand corner.